Improved detection of right colon adenomas with additional retroflexion following 2 forward view examinations, a prospective study. Introduction. Colonoscopy is an effective and widely used technique for screening for colorectal tumors. Effective screening leads to a reduced incidence of colorectal cancer, CRC, and cancer-related deaths, increasing the adenoma detection rate, ADR, and decreasing the miss rate are essential to effectively reduce the incidence of CRC. Previous studies have reported an overall miss rate of 22% to 28% for polyps and 20% to 24% for adenomas. These miss rates have been associated with several factors, including cecal intubation rate, inadequate bowel preparation, endoscopic technique, and the time for colonoscopy withdrawal. Moreover, colonoscopy is less effective in preventing right-sided colon cancer than left-sided colon cancer, which could be attributed to right-sided polyps being mostly flat and thus difficult to detect compared with pedunculated polyps, which are unique to the left colon. Moreover, right-sided colon polyps are frequently located on the proximal side of the haustral folds and in the medial aspect of the hepatic flexure, which could make them more difficult to identify on forward-view colonoscopy. Retroflexion in the distal rectum is a safe and effective technique for increasing the detection of polyps. Previous studies have shown that retroflexion in the right colon improved polyp detection. However, retroflexion in the proximal colon did not significantly reduce the miss rate of colon adenomas. The aim of this prospective study, therefore, was to determine the effectiveness and safety of right colon retroflexion after 2 consecutive forward view examinations for the detection of additional adenomas. Background and study aims. Colonoscopy in the right colon is less effective than in the left colon in screening for colorectal cancer. The aim of this study was to prospectively evaluate the diagnostic value of retroflexion in the right colon. Patients and methods. A total of 1,020 patients undergoing screening or surveillance colonoscopy were enrolled. After the first cecal intubation, the scope was withdrawn from the cecum to the hepatic flexure in the standard forward view, and all identified polyps were resected. A second examination from the cecum to the hepatic flexure was then performed in standard forward view, and finally a third examination of that same segment was conducted in retroflexion. Additionally detected polyps at each examination were removed. The main outcome measures included the proportion of procedures with successful retroflexion, the additional yield for adenoma detection, and the adenoma miss rate. Results. Retroflexion was successful in 840 patients, 82.4%. Retroflexion detected a significantly greater proportion of patients with adenomas in the proximal segment than the 2 standard examinations combined. Forward view 25.5% versus total examination 27.5%. The per adenoma miss rate of the 2 standard examinations in the right colon was 10.4%, 52 of 502, and the per patient adenoma miss rate was 4.9%, 50 of 1,020. The detection of additional adenomas using retroflexion was associated with age greater than or equal to 55 years, gastroenterologist experience, and the presence of polyps on forward view examination. Conclusion. Colonoscopic retroflexion in the proximal colon resulted in an increased detection of adenomas even after 2 consecutive forward view examinations. Trial registered at Clinical Research Information Service, CRIS, KCT 0000725.